Hi, my name is Janine Fee. I'm a physical therapist here at Evan, and I've been here since 1998. And since that time, we have created a balance/vestibular center. Vestibular is a fancy word for inner ear, so we'll talk a little bit more about what I do specifically to the inner ear to further assess that as we move through this PowerPoint or presentation. Today, we are going to talk about balance and the many factors that can affect our balance. And so I'm going to start out with the three main factors that affect our balance. Think of your balance like a baseball field. Every player on the field has a reason for being there. And if someone's not working to their full potential, then your team isn't as good. Balance is often a team approach. It's usually not just one factor contributing to a balance problem, although it can. It's often a combination of several factors making our balance not as good as what we would like it to be. So if we use that baseball field analogy, we're going to talk about each of the players on the team and what maybe you can do to impact those players to make your team better. The three outfielders is where the balance begins, or where the information about our balance is coming into our system. Those three players are our eyes, our inner ears, and our sense of touch, the information that we gather through our feet. So the first thing I'm going to talk about is our sense of touch. People who have neuropathy, where you can't feel in the bottom of your feet, are at a significant disadvantage for our balance because we no longer have the information about what surface we're standing on to bring that into our system to tell us if we're on slippery surfaces, unlevel surfaces. So if you lose that sense, you're losing an outfielder. So that outfielder is now sitting on the bench, and you have to over-rely on your eyes and your ears to sort of help manage the field. So now you're down to 2 players versus 3 players. If you have things like neuropathy, some of the things from a therapist perspective that we might recommend is using a cane or a walker. Those devices help to enhance our sense of touch because now we're getting input through our hand about what surface we're walking on to help enhance those players in the outfield. So now you're using a cane and you're basically adding an extra player from the bench onto the outfield. So now you have your eyes, your ears, and your sense of touch coming through your hand. So sense of touch, major role in our balance. The second thing I'm going to talk about is our vision. Our eyes play a big role in our balance. So for example, if I close my eyes, that's essentially taking a player off of the field, and now you have to rely on your ears and your sense of touch to play your field. And often as we age, we use our eyes predominantly for our balance. It becomes our dominant player. And the dominant player, when you rely on it all the time, it basically calls the shots. And when you take that dominant player away, now you're forcing the other 2 to work a little bit harder. So often, therapists, if you've ever been to therapy for some balance exercises, they may have you close your eyes. And the reason they have you to close your eyes is because they want to take that dominant player off the field, and they want to force the ear to work a little bit harder, and they want your sense of touch to work a little bit harder. So oftentimes the therapists don't tell you why they're telling you to close your eyes, or if you're at a fitness place where they say close your eyes, it's because you're taking away one of those senses of balance that's usually we use a lot, and now you're forcing the other systems to work a little bit harder. So that's your sense of vision. So if you have problems with cataracts or your depth perception's off, all of that can definitely affect our balance in some way. The third player is our inner ear. Our inner ear is our internal reference frame of where our body is in space, and it's our quick movement detector. And quite honestly, as we age, we start to develop some weaknesses in our inner ear because we don't move as quick as we used to when we were younger. But there's definitely some therapy that will increase or enhance our inner ear, or also known as our vestibular system. I have become known as a vestibular therapist. I have created the balance program here at Evan roughly in the year 2000, and the inner ear has really developed since over the last 20 some years, where we have now identified lots of different kinds of inner ear problems that can contribute to a balance issue. Or if people say they're dizzy, we're talking people might feel like the room is spinning. Those are some specific inner ear problems that I can often look at. And the question is, how do we look at the inner ear? The inner ear is very, very small. It's about the size of the tip of your finger. It's so tiny that often if we order image studies like MRIs or CAT scans, because it's so small, those image studies don't really show us the inner ear well. So what we do, or what I do, is I look at a person's eyes. Eyes are connected to our inner ear through reflexes, and if there's something wrong within the inner ear, the eyes will actually spin funny in your head. And the direction those eyes spin can help us to identify what's happening from an inner ear perspective. Lots of people ask me, well, how come I'm not seeing an ear, nose, throat doctor? Well, I work very closely with the ear, nose, throat doctors because the inner ear is often looked at by the ear, nose, throat doctor, but it's also looked at by me. This is the inner ear blown up. It's, again, really tiny, about the size of the tip of your finger. And if you could split the inner ear, this is the hearing portion of the inner ear. This is the dizzy or the balance portion of the inner ear. So the hearing portion of the inner ear is often assessed through the ear, nose, throat doctor with an audiogram or a hearing exam, whereas the vestibular system is this part. This is my area of expertise, and this is where this can cause balance issues or dizzy issues depending on what your problem is. And the way that I look at this inner ear is through your eyes. The best way to really look at some of these different inner ear problems is by using a pair of goggles. These goggles are called Frenzel lenses, and you put them on, or you will have them on as the patient when you come to see me, and basically they highlight your eyes, and they make your eyes really big, and then I put you through a bunch of different kinds of positions and things like that to try to provoke your symptoms. And if we can provoke them, oftentimes it will create this eye movement, and depending on the direction that the eyes move, helps me to identify what type of inner ear problem you're having. There's a lot of different inner ear problems that can create dizziness or unsteadiness. The most common thing I see in here is a problem called benign, paroxysmal, positional vertigo. Benign means no big deal. Paroxysmal means it sort of comes and it goes. Positional, it's brought on by a position, and vertigo means I got this spinny or twirly sensation. That affects this part of the ear where we have these little calcium carbonate crystals that belong in this area of the ear. These little crystals are so small you can't see them. They're the size of a speck of dust. So if you can see the crystals, this is what a crystal looks like. That's one crystal. And those crystals are held together with what we call linking filaments or glue, really nicely, tightly meshed together in what we call like a cobweb type substance. Those crystals can dislodge off of that cobweb. And if they dislodge off of the cobweb, they can find their way into this hole and make their way into one of these loops. They do not belong in these loops. These loops are full of fluid. So if you think of this as a lake, you have a rock at the bottom of the lake. If you're not moving, your lake is very calm. But you go to change position, like lying down in bed. Whoosh, that rock moves and everything starts to kind of twirl a little bit. If you stay still, that rock settles down and your dizziness kind of subsides. But if you go to get back up, it will happen again and you feel it again. So changes in position can often provoke this. And a lot of people won't complain of spin, but they'll just have this off-balance, drunken type feeling. So my job again is to look to see if this is a problem. This certainly is going to affect your balance because now you have a mechanical problem with the inner ear, meaning something's out of place. We got to get it back to where it belongs. And once it's back, miraculously, your ear starts to adjust and you're back to kind of somewhat normal again. But your inner ear is one of your major balance mechanisms. So again, those three outfielders, each one of them, your eyes, your ears, your sense of touch, there are things that can happen to us because we've gotten older, or just have happened to us because we've had a fall of some sort that caused one of these things to happen. So once we look at those three outfielders, one of the ways that we look at those three outfielders here in the clinic to give us a little bit more data to investigate how those three systems are working is that we use this neurocom system, where we have people stand on this surface, and we will put this foamy thing down where we will have you actually stand on this unlevel surface. So this, by standing on this unlevel surface, as you can see, it's really squishy. It takes away our sense of touch. So now I have to use my eyes and my ears to keep my balance. But then I'll also have you close your eyes, and then you'll feel a lot more wobbly because now I took away my eyes and I took away my sense of touch. So the only thing left there is my ear. And what it does is this computer then projects how good I am at the different conditions, to look at how balanced you are with your eyes, when you take your eyes away, when you take away your sense of touch, and when you're just dealing with your ear. And here it comes up with a nice little graph. And if you can kind of hone in here, this is my daughter. So that's the name that you'll see up there. And eyes open, eyes closed, eyes open on the foam, eyes closed on the foam. If you're in the red, it means that you have an impairment. If it's in the green, it means, oh, you're doing a really good job. But what this does is it helps us as therapists to analyze maybe where your deficits are, and then we're able to provide you with the most appropriate intervention that's going to be suitable for you as to what's going to help enhance your overall balance. So it just gives us a little bit better understanding of your particular problems. So that's the ear. So eyes, ears, and sense of touch. Once those three systems gather the information about our balance, they then send it to the brain. The brain, I call him the pitcher on the mound. There's a part of our brain called our cerebellum that processes all that information that comes in about our balance. Once the brain processes that information, the brain will then complete the play. The completion of the play is, I'm going to feel good and balanced, and I'm not going to fall over. So certainly the brain level, let's talk about the picture a little bit. If there's something wrong with the brain, so say there's something wrong with the cerebellum, sometimes there's things that can happen to our cerebellum. We can have strokes. If we have a stroke, then the picture is going to not be able to respond as quick. So certainly a stroke will cause some significant balance impairment. There can be some diseases that happen to that balance center. So there's things from a therapist perspective that we can look at to sort of help to enhance that or try to make it a little bit better. Then, once the pitcher gathers that information about our balance, the completion of the play is sending the information to the infielders. And the infielders represent things like, what's your strength like? What's your posture like? Do you have any pain anywhere? Are you afraid of falling? All of those factors can contribute to a balance issue as well. So when you work out at a gym is really good at trying to enhance those infielders because we work on strength, trying to build up our leg muscles because, of course, our leg muscles are important in balance. Our feet muscles, very important in balance because we use our toes, we use our ankles to sort of help with these balance strategies and strengthening to keep our balance or to keep us upright. So what I do, again, as a therapist, we look at all of these players, including the infielders, because if you have some strength deficits or pain, then we want to work on those things as well. So there's some specific exercises that we will give you based on what we find during your evaluation. To get a referral to see someone for physical therapy for a balance issue, or if you're concerned that you have an inner ear problem, you have to talk to your physician first, talk to them about your problem, and then the physician can talk to you about getting a referral for physical therapy to further investigate some of these balance players and to see if we can then create something that's going to be beneficial to you to strengthen your overall balance and decrease your risk of falling. Thank you for watching this little segment. If you have any questions in regards to your balance, or if you want to further investigate as to maybe why you might be falling, or we could offer some fall prevention techniques. We could further investigate if, how your baseball field is working, see if there's something in particular that might work for you that we could recommend. Oftentimes we'll see someone 1 or 2 treatment sessions to look at some of those things and provide you with what we call a home exercise program that you can continue with on your own at home, or incorporate it into what you're already doing maybe at the fitness center, which we find to be very helpful as a transition, especially working together with the fitness center to enhance your overall balance system and prevent those falls from happening. So if you have any questions, you're welcome to call. We do have clinics, outpatient clinics in Selinsgrove, Middleburg, Elysburg, of course, Lewisburg. My main hub is here at the Miller Center in Lewisburg, and our phone number here is 570-522-0660. So if you have any concerns about your balance or dizziness, talk to your physician and get a referral. Thank you.